Interventional radiology is the use of contemporary imaging like real-time X-ray, which is this example here. This is fluoroscopy, and this unit right here is a fluoroscopic C-arm. So you can basically take an animal and look at them in real time when they're under anesthesia and find your way into different parts of the body. So we can combine that with both endoscopy, which is this tower right here, where we can take an endoscope and we can go into a part of the body. For example, we could take a scope and go into the urinary bladder, and then from there we can see the opening to the ureter. And when we can see that opening, the ureter is the tube between the kidney and the bladder, then we can get access to that with a guide wire or with a stent if there's a urinary obstruction in the ureter. But we can't see that through the bladder, so we use the real-time X-ray to find the ureter and use that wire and that stent to put that in place so that we can open an obstruction. So basically what it boils down to is interventional radiology just uses the fluoroscopy. Interventional endoscopy uses both in combination. And what we typically can do is if something is inappropriately closed, like if there's a tumor obstructing an area or if there is a stone obstructing an area, like for example maybe tracheal collapse, the trachea is collapsing so an animal can't breathe, then what you can do is you can take a stent and you can open it. And then if something is inappropriately open, like this, which is a intrahepatic portosystemic shunt, you can see here that this is the vena cava here, and this is the portal vein, and this is the shunt communicating between the vena cava and the portal vein right here. You can actually take these thromboembolic coils and you can put that into the shunt, and then that's going to close it off. So we can close something that's inappropriately open like a shunt, or we can open something that's inappropriately closed like a ureteral obstruction with a ureteral stent, or a urethral obstruction with a urethral stent. So that's basically the bottom line, and we do all of this through tiny little incisions like a little needle poke into the neck. For example, we can fix this intrahepatic shunt without dissecting the liver, but just do a little hole in the neck. Or for ureteral obstruction, there's no hole at all. We go through the natural orifice like the urethra. Or for a tracheal stent, the natural orifice like the trachea. So we don't have to do any surgery. So basically, this is just minimally invasive therapy, all image guided.